Thank you, Mr. Chairman, and good morning, colleagues, and good morning to the witnesses. Thank you for being here. We're all looking forward to hearing from you. Today, our subcommittee is considering 15 bills to expand access to telehealth, and the majority of them are bipartisan. So that's good news to everyone here in the hearing room. Telehealth is, I think, one of the few bright spots that emerged from the pandemic. During the public health emergency, HHS waived many outdated rules and payment policies surrounding telehealth coverage in traditional Medicare, and these changes really ensured the continuity of care for patients who obviously, like the rest of us, needed to stay home and out of crowded care settings like doctors' offices or hospitals. The year before the pandemic, 2 million of the 66 million total of Medicare beneficiaries used telehealth services. I know I represent the Stanford Medical Center in Palo Alto, California, and previous to the pandemic, there was a single-digit usage of telehealth with many suspicions about it, which really prevented people from moving forward and using it. When they did, it zoomed up to 90-some% approval. So those numbers really speak for themselves. So from March 2020 to February 21, the HHS Office of the Inspector General found the number of beneficiaries using telehealth skyrocketed to 40% of all Medicare patients. So it reflects what I said, what we experienced right in my own congressional district. Importantly, telehealth served as a lifeline to beneficiaries, as I said, that were isolated from their families, especially those that were in need of mental health services. By the end of 2020, virtual visits with mental health providers were as common as in-person visits. Telehealth has been, I think, a godsend to the disabled community as well. And we need to make sure that that is protected because they obviously use services on a more frequent basis. The whole notion of having to travel, to get to park, to get in, all of that is especially burdensome to that community. So I think the changes that HHS made, they set a standard for the private insurance companies who increased their telehealth offerings for millions of Americans. So this issue of telehealth remains, I think, in all of our view. This is not a partisan issue. It remains a very important tool across healthcare for all the obvious reasons and what the chairman of the committee expressed. There's an urgent need to extend these flexibilities because it's going to run out, and we need to take action on this. So there's more that I can say about it. We're all for it. We know that what HHS did during the pandemic, they cleared many weeds away. It worked well. But I don't want to see inside the healthcare industry, and it's not called industry for nothing, the gaming of telehealth. So we're going to look to you to give us advice about how best to structure it as we move forward to meet the needs of so many Americans that already have had a good experience with it. And we want to continue it. We want to make sure that those that would game it won't be able to because there's costs, money associated with this. So thank you, Mr. Chairman, for holding this hearing. I want to thank those members of the committee that have offered legislation, and I yield back.